The hygienist will help you keep your teeth and gums healthy. She will show you the techniques for your oral hygiene routine, and she will scale and polish your teeth, so removing all the deposits which are harmful. As soon as you've brushed your teeth, a protective jelly-like layer begins to form on each tooth surface. Over the course of the day, bacteria will stick to this layer. This is known as plaque. If it is not removed daily, it will cause gum disease, and combined with sugar, it will cause tooth decay. Tartar is formed when calcium in your saliva combines with plaque and hardens it. It is particularly common behind the lower front teeth, where there is a major salivary gland opening under the tongue. Once tartar is there, only a hygienist or dentist can remove it. Whilst tartar doesn't cause gum disease, it is rough and attracts plaque to the area. It is impossible to keep the area clean. When plaque is not removed from the gum margins, it releases toxins into the gums, so all the white blood cells rush up to the gum tips to protect them. Hence the gums become red, puffy and swollen. Sometimes they are uncomfortable to touch. Gingivitis is completely reversible with a good, thorough scale and polish, sometimes taking more than one visit, and a good oral hygiene routine. This is the next stage of gum disease. The inflammation is spreading under the gum and creating pocket, which are gaps between the tooth and gum. These gaps can be measured with a probe by the hygienist or dentist, and the deeper they are, the worse the problem in that area. In time, the bone can shrink as it continues, the tooth loosens, abscesses can occur, and the gums may recede, exposing the roots. Often no pain is involved until the very late stages of the disease. Ultimately, the tooth becomes loose and falls out. Treatment will depend on how far the inflammation has gone, which is why it needs to be treated as soon as possible. The hygienist will remove all deposits from the pockets by scaling, which may take several visits. As the teeth and roots become smoother and cleaner, the gums will generally tighten and any loose teeth will become firmer. The success of the treatment will depend on the cooperation of the patient. Occasionally, inflammation persists. In these circumstances, further treatment will be considered. This may include a referral to the periodontist. Here at Bowlane Dental, we generally recommend an electric toothbrush. Angle the brush at 45 degrees so it is part on the tooth and part on the gum. Let the brush do the work whilst you move it from tooth to tooth, allowing 2 to 3 seconds for each surface. Follow a pattern so nowhere is missed. It is recommended that you use a brush with a timer so that you can brush for the recommended 2 minutes. You may scrub the biting surfaces, but not on the gum margins as you may damage them. It is recommended to use a brush with a pressure sensor that will cut out if you brush too hard, therefore preventing any damage to the gums. The gums may bleed when you first start to brush this way, but persevere, and within a day or two it will stop. If you're using a traditional toothbrush, place the brush at a 45-degree angle. With a very gentle back and forward motion, or better still with a circular motion, brush 1 or 2 teeth at a time. Tongue cleaning removes bacteria that can cause bad breath, and also bacteria that can be transferred to your teeth and gums, resulting in gum disease and tooth decay. Your mouth is not fully cleaned unless you clean the tongue as well. Use a gentle scraping action on the tongue surface 2 to 3 times, as far back as you can go without gagging. It's more effective to use a tongue cleaner than a toothbrush when cleaning the tongue.